Hi. Hi, Casey. Um, isn't it funny? Yeah, sometimes you come in under a different name. So, anyhow, this is going to be a very relaxing presentation, I hope, and one in which you can ask a lot of questions. Let me share my screen with you. I have my PowerPoint ready here to go. When I first learned about relaxation techniques, I felt a little bit funny about trying them, but I want to try to encourage you to actually practice today as we get into start practicing these. Because if you never practice them, then you obviously will never use them. So there's there's not much point to learning how to relax if you can't try some of the skills or tools out. So that's what we're going to talk about today. Three stress management tools that you can use anytime, anywhere. And I wanted to come up with three tools that we could use anytime, anywhere, because nurses face a lot of stress every day. And by the way, I am a nursing professor at Penn State Behrend, and I teach nurses and I teach them also leadership skills and how to function in a really high stress clinical environment. But we're all under stress, aren't we? Especially during these times. I wish I could be just like this guy right here all the time, don't you? So I want to welcome you for coming today. We're going to take about 30 minutes, so I'll try not to talk too much. I do want you to know that as a nurse, I'm very dedicated to what I call holistic wellness in all of my clients. And holism, that word means that the person is more than just the sum of their parts. So I'm going to just move our pictures over a little bit. I have a kind of a mechanical picture of a person here on the slide. And in healthcare, we often think of the person as a machine. And if a part is, there's a bone in your shoulder that's not quite right, we take it out and put in a joint replacement. And that tends to work pretty well for a lot of problems, but it doesn't work very well for stress because there's a lot of biochemical changes that are going on in the body. Stress isn't just stress, it changes the whole biochemistry of the body and leads to a lot of really negative things happening. But holism means the person is more than the sum of their parts, meaning that we're not just psychological, we're not just physical, social, spiritual. Even if you added all those parts together, we would be something more altogether. We're very special. There's something special about being human. And the truth is, we're composed of multiple systems that are in constant minute by minute interaction. And there are scientists who study this interaction between our neurological, endocrine systems, our immune systems, and our psychological state. And we know that when we experience stressors, these are things that create stress, that it actually changes our biochemistry. So we all want to live a very full and happy life. In order to do this, we really need to strive to control stress in order to live the most rewarding, fulfilling lives that we possibly can. Um, Perhaps you're here because stress often gets a hold of you, or you just want to enhance your life and be the best that you can be. Maybe you want to feel a sense of peace and happiness. Really, it starts with just choosing that. It sounds kind of corny, but it really is true. We make a decision every day on how we're going to be that day. We really do. So I personally had to learn through life experience to control stress. So first of all, I could learn to function well in life, and then learn to function in the high stress role that I selected as a nurse. And I have to tell you, it wasn't easy growing up in my house. I lived in a very chaotic house, and I just couldn't believe it after I got married and moved out, how much better I felt, because sometimes we live in dysfunctional living situations. We don't even realize that we're facing a lot of stress every day. And so, I wanted to start out by just asking you to think about this. How much stress do you normally find yourself under right now at this time in your life? And how do you respond to it? When I was in grade school, I had a stomach ache that was persistent all the time. And even into high school and early in college, if I had to give a report in front of the class, it was something that really stressed me out. And I couldn't even speak. Sometimes I'd stand in front of the room and just cry. So, obviously, I can laugh about it now, and I've learned, how to move on. So I was going to take a poll. Oh, I think I can do a poll here. Maybe not. Well, anyhow, just think about this for a moment. Do you have a lot of stress almost every day? Or do you just like once a week have a really stressful episode? Sometimes we bottle things up and then they just, happen. Or do you feel calm almost all the time, but just periodically you have stress that's really hard to manage and you don't know how you got there? Or, as I said, maybe some of you rarely have stress and you just want to learn how to manage it even better. And I have to tell you, think about it for a moment, the enormous power that you could have if you could control your emotions and not feel the impact of some of the stressors that face you. So, stress is technically a state manifested by symptoms that arise from the coordinated activation of our neuroendocrine and immune systems. So, Hans Selye was a theorist that called this general adaptation syndrome. And some of you may have learned about this already, but the key is to recognize the feelings and symptoms that well up that are related to stress. And if you make a conscious effort to do so, you'll start recognizing these earlier and earlier on. Having difficulty breathing, pounding in the chest, sweating, getting so angry, feeling like you're going to cry, muscles tensing up your jaw, your shoulders, etc. It doesn't have to get to that point. Okay, it really doesn't. And I'm just giving you a little background information to consider right now, because it's very important that you use these stress management techniques that we're going to talk about today at the start of stress. So we can even feel a lot of, maybe you'll recognize the emotional symptoms more easily, be feeling unhappy, uneasy, feeling like, oh gosh, I just can't do anything to deal with these problems. So defeated, or even feeling angry. I find it's true too that different things get us stressed out more than others, but it's an individual thing. I find people behaving badly really stresses me out. So when somebody tries to pick a fight with me or bully me or take me on, I get very, very stressed out and upset because I don't like conflict. So we're all a little bit different, but please keep in mind that if you keep letting this stress go uncontrolled and you don't do anything about it, it will have a negative impact on you. And if you don't yet care about your physical body, it gets worse as you get older, the impact that it has, because it wears on your body over time. But at the very least, think about how great you could feel if you were able to unload some stress that you have. So, I just want to put this out to you, because I remember long ago when I was young reading that when you wake up in the morning, you choose how you're going to be. Do you want to have a stressed out day, or would you like to have an enjoyable, relaxing day? So part of it's a choice. And then, of course, there are days where just a lot of bad things happen. The alternative is, to not doing anything to manage stress is to suffer from chronic stress. and it leads to a lot of problems like stomach discomfort. I used to have that just as a child. Problems sleeping, we've all had that before. Decreased libido, muscle strains, headache. Some people have anxiety attacks and develop thoracic angina, chest pain. Over time, we can develop, and this shows you that it's real. People who have heart attacks, for instance, tend to be, you can have them for different reasons, but one reason is having this type A, high stress type of personality. Having high blood pressure over time weakens your arteries. You'll have anxiety, digestive disorders. And nurses, I talk to nurses a lot, they can get burnt out and to where they're not really paying attention to the job that they do, and it can affect their patient safety. So nurses like me, we're beginning to realize that we really need to teach our clients how to reduce their stress. And I get a little annoyed because we just say to nursing students, well, you have to learn stress management techniques and teach your patients, but we never tell them how to do that. So that's why I developed this program, is not only to help nurses, but for you today to just practice 3 stress management tools or techniques that you can use to help keep you in a relaxed, balanced state. And it's important. I also did a little study of habits and how habits form. And if you practice these techniques as a matter of habit, that means every time something stressful happens, you start to do deep breathing or other relaxation exercises. If you keep doing that in a little bit of time, when you start feeling that stress, automatically you'll start deep breathing, for example. That's one tool we're going to talk about today. So keep in mind, I'm not saying that we can control all stress. We're going to have stressors. We all have them, but we can control our response. And I think people owe it to themselves to identify their personal stressors, what really makes them wig out, and then to become masters of stress management. And it's something that I continually work on myself. I don't think it's as hard to do as you probably think it is. So I always recommend just start with a firm commitment. Set a goal. Say, I'm going to do this. I am going to practice this and see what I can do to control stress. Make a commitment to care for yourself too. I have learned, early on in my nursing career that I couldn't go out and stay out half the night like I did when I wasn't a nurse, because I was just too tired. I was too tired to give anything to my patients the next day. So I learned that being tired really makes me feel stressed throughout the day. So I make sure most days I get to bed on time. And things like making sure that you eat throughout the day, get plenty of sleep, just take really good care of yourself. I exercise regularly. I go work out every day for an hour. I used to go to a gym and lift weights and run a little bit on a treadmill. Now I walk around in the neighborhood for an hour. So this helps unload stress, so it never becomes a big thing. So create regular habits that help you to maintain a balance, and then start using these techniques that we're going to talk about. Practice them first and then use them when stress occurs. Once more, I just would like to emphasize that in the field of psychology, the term habit indicates a process where one behaves a certain way every time when exposed to a cue, and the process becomes learned and automatic. So this really does happen. It's amazing how it happens. You can build habits, and you can build the habit of responding to stress with relaxation techniques. Herbert Benson, he's actually right here. He's a little old man now. He's quite mature now, I should say. He is quite the powerhouse in stress reduction, and he wrote a book a long time ago, I think in the 70s, called The Relaxation Response. And he asserted that just as we can enter an all-out stress response, I like to call it wigging out, we can circumvent it or stop it by consciously choosing relaxation techniques. And he started with this, and he really, if you look at him on YouTube, he just tells you about deep breathing, like I'm going to talk about today, and using a mantra to kind of stop that tension from occurring. So once more, I'll just recap. Pay attention when stress starts. Note the uncomfortable symptoms that you have, and start using these tools every time. And the tools that we're going to get to now, I don't want to talk too much more about background because I won't have time to get to them, is relaxation breath work, using a positive mantra, and guided visual imagery. And when I wrote this, I actually wrote an article for a nursing journal just on this. It's not going to be published for another year. It takes a long time. But I thought of things that people could do right in the moment while you're out and about, So deep relaxation breathing is one thing that you can do. We all have to breathe anytime, all the time anyhow, right? We're all breathing. No one's going to know if you're doing slow, deep breathing. But sometimes I use it as an indicator to my family members that I'm stressed out. Like I'll actually be very exaggerated about it, going, so they know that I'm already decompressing. It's like a warning, stay away. But slow, deep breathing has actually been the mainstay of Asian culture, and it's used for healing and transformation. And it's a fact, it's a research fact, that intentional control of breathing can actually bring about the relaxation response. And using this deep breathing puts the brakes on the stress response, because we have a sympathetic nervous system that keys everything up, increases your heart rate, increases your respiratory rate. But deep breathing is a part of the parasympathetic system. So it kind of triggers the parasympathetic nervous system to kick in. And what I've read too most recently is if you breathe in through your nose and out through your mouth, when you breathe through your nose, nitric oxide is produced in your body. That's not nitrous oxide, it's nitric oxide. And this is a gas that acts as a cellular signaling molecule. And it relaxes smooth muscle fibers. We have these smooth muscle fibers in all our major blood vessels. So it helps to dilate them or relax them. So it'll decrease our blood pressure. It reduces blood clotting. It acts as a neurotransmitter in our brain and throughout our body. So it helps with communication of neurological signals. So we'll be thinking more clearly. And it helps with immunity and oxygen flow to the brain. So we know that deep breathing works. I just realized I've been talking all this time and I didn't ask you if you have any questions at all. Does anyone have any questions or comments right now at this time? Please feel free to ask if you do. See a chat here. We actually learned about the parasympathetic nervous system in AP Psych earlier this year. That's great. I'd love to take that class myself. And okay, so Casey, I got your message too. So yes, there's a lot to learn about this, but if you haven't had the opportunity to take a class like that, just know that deep breathing is very effective in reversing stress. So, I thought that we could, I'm just going to give you some guidelines and we'll just take a couple of deep breaths together. It's just a simple thing. But what I've seen recommended is to practice deep breathing before you really need it. So maybe before you get up out of bed or while you're getting ready in the morning, putting your makeup on, blow drying your hair or whatever, you could do some deep breathing. At one of your meals, always do some deep breathing. Maybe afterwards, it might help digestion. And then before you go to bed, because if you're practicing, then you just know how to do it. It's a part of your life. So I believe that you really should commit to practicing the skill first, and you can practice all of these ahead of time before you really need it, when you know how out of control you can get when you're stressed. Now, some people don't get as stressed as some of us. My husband, for example, he's a very calm man. And I think that's one of the reasons I fell in love with him. He's just so calm. He helped to calm me. So being around other people who are calm helps. But once more, I would recommend taking your slow, deep breath in through the nose, feeling the air move into your abdomen. And some people recommend putting a hand on the abdomen, and as you breathe in, kind of, push that abdomen out and let it fill up with air. You can imagine that. Concentrate on the diaphragm expanding as you breathe in and then going back down as you breathe out. So breathe in, they recommend for 6 seconds. If you can't do that right now today, let's just try 3. Then pause briefly and then breathe out. And then when stressful events happen, even if they're minor, just begin responding with deep breaths. And then guess what? If you do this consciously at first, like, oh boy, I'm getting stressed, I'm going to do some deep breaths, then it's going to just become automatic if you do it enough. So let's just take a couple deep breaths together. Nobody sees you. So don't be afraid to play with me today. Okay. Nobody's looking at you, hopefully. You might have someone in your room, I suppose. But let's take a deep breath in through the nose. Pause and then out. Let's do this 4 times. Pause. Pause and out. One more time, in through the nose. Pause and then out. How do you feel right now? Did anyone have a moment yet to open up your eyes? How do you feel? Do you feel a little more relaxed? Anybody want to chat and tell me? Well, if you did the exercise, chances are you might feel a little bit better. So that just seems very simple, and it is. I heard someone say something.
I felt a little bit better.
Right. And you're just getting started. So if you practice and do maybe hold it in for 6 and let it out to the count of 6 and close your eyes and, take it, now that you see how to do it, it'll become less mechanical and more easy, as you keep practicing. I always feel a little lightheaded. Makes me wonder if I'm breathing at all normally. Do any of you ever find yourself breath holding? I used to have a brother, he's very stressed out, and he would do this stuff. Do any of you do that? That's really bad for you. Give me a thumbs up if you ever find yourself doing that.
Now that you actually say it, I think I do it.
Yeah. I think we do it when we're stressed out the most. So if you, once more, that's a stress response. So if you see yourself doing that, say, I'm tense. I'm going to start doing a little deep breathing here. And do those deep breaths. So that's one technique. I'm going to move on because I'm eating into my time. Another thing that I've done a lot is I've used a mantra. A mantra is a short phrase that is used to remind oneself of a belief that you would like to hold constant. something positive, an inspirational message that you'd like to remember and then incorporate in your life. So some examples are, well, some people like to stress mindfulness and they'll say, be here now, to remind yourself not to get all up in your head and thinking all these negative thoughts, and instead just be here right now. And some people need confidence. I used to need more confidence. So saying things like, I am strong, I am beautiful, I am enough. Or if you just want to settle yourself down, you might just take your breath and on exhalation say, peace. Have any of you ever seen the movie Anger Management with Adam Sandler in it? It's an older movie. Give me a thumbs up if you ever saw it. It's about all these people who have anger and they're taught by their psychologist to use a mantra. Okay, a couple of you have seen it. And do you remember what they were told to say? Goose fraba. Goose fraba. Now that doesn't have any meaning at all, but they were taught that it's some kind of Eskimo, and I don't know if it is or not, an Eskimo term that reminds you to be calm. But you can really come up with any mantra you like. I even use my mantra as my computer passwords. So now I can't tell you what it is, but you could say, I'm open to peace, or open to goodness, or just breathe, breathe. And that Dr. Benson, he believes that breaks the stress response. And instead you're concentrating on something else. So a positive mantra can help keep your attitude positive. And I would encourage you to just take an hour and write down some ideas that you have, things that you want to work on. Maybe it is to be more confident, and to say, I'm a good person. I'm enough. I'm doing my best, or whatever has meaning to you. But when you put your attention on that single thought, it shouldn't be too long. It may comfort you. It reminds you to not get lost in negative self-talk. So if you're saying negative things to yourself, like, I work with a colleague and she's always saying, oh, I'm so stupid. I can't believe I did this stupid thing. And I'm always correcting her and I'm saying, I'll just call her Meg. Meg, you are not stupid. You're a highly intelligent woman, and I will not tolerate you saying those negative things about yourself. So be your own, best self-coach. You're not going to get rid of stress if you're beating yourself up all the time. We all have something to contribute in this world. And most people are insecure in one way or another. You're not alone in that. We all have insecurities. And if you can believe it, when I used to walk down the sidewalk, if someone was coming in my direction, I'd go on the other side of the street to avoid making eye contact with that person. So all of these things that I'm teaching you today have really helped me. But finding out that other people felt just as insecure as I did really gave me a lot of comfort. And it made me want to help other people and myself too. So another idea is, if you do have these negative thoughts coming in, recognize them, say something like cancel, and then consider using your mantra. I am good. I am strong, or whatever has meaning to you. And then finally, does anybody have any questions about mantras before we go on to the last one? Or any comments? Have any of you used that with some success? Well, give it a try and see how it impacts your life. Try to be open to it. Sometimes it's hard to change how we think, but sometimes we're doing ourselves a lot of harm by not being open to thinking of how we can approach the world in different ways. Okay, finally, there's guided visual imagery, and this is something I use a lot. You actually have to take a short break for this and close your eyes. But you may need that. If you find you're really getting tense in a situation, you should just leave that situation for 5 minutes, even if you have to go to the bathroom. If that's the only place you can go, sit down on the toilet and do some visual imagery, okay, just for 5 minutes. People can wait outside if they need to. But what you do with guided visual imagery, once more, it helps to decrease stress. All of these things have been found in research to decrease your stress response. And you use your power of your imagination to take you to a place that you find very relaxing. So you use visualization and imagination, and you picture and use your senses, and experience. You use your imagination to picture the senses and experiences that closely resemble the real scene, object, or event that you find relaxing. And you think about the stimuli that you would see in that setting. So whenever you're going to be in a stressful situation, you can use this. The usual prescription is to try to find more balance in your life by taking 2 times a day, just for 5 minutes for starters. You can do it longer if you want. You could maybe do it right before you wake up or before you go to bed at night to help you sleep. And once learned, you can use it anytime you need to recharge. So this is something that you do to recharge, and it helps you physically because it'll slow down your heart rate and respirations and tension in your muscles, or psychologically. I use this when I'm going to the dentist, for example. I'll start getting stressed. You're in the chair and the drill starts going, most of you know that feeling. You can smell that smell of teeth in the air. No, I don't want to be there. I go to my favorite place, which is near the ocean surf. And I purposely relax my muscles and start envision, do my deep breathing if I can with my mouth open. Each time I breathe out, I imagine the surf is coming in from the ocean. And I'll imagine the seagulls going, and the sun's on my face, and the wind is blowing through my hair. And I'll imagine myself taking my hand and letting the hot sand flow through my fingertips. And all of a sudden, having my teeth drilled isn't as bad of an experience after all. So I'll use both deep breathing and guided visual imagery. So where is your favorite place? Is it in the forest? Just look at this for a moment. Isn't this fantastic? I would love this. I love being in the forest. When I was in high school, people called me Pioneer Woman because I would run through the woods. But this is pretty great too. And in Erie, we have a lot of beautiful sunsets. And actually, this is one of my favorite times of the day because of all the color. I love color. And then this is being on the ocean surf. So I thought we could try for a moment to do this. So if you would please just play with me one more time. First of all, think of a place that you find relaxing. And it doesn't always have to be a place in nature. You might have fond memories of sitting in the kitchen with your grandma, sipping tea and eating rice pudding. This is unique to you. So let's just take a moment. Please give it a try. Close your eyes. Sit straight. Relax. Unfold your arms and legs if they're folded. Close your eyes. And let's take some three deep breaths in. Hold it and out. 2 more times. If you notice any tension in your face, let it go. Tension in your shoulders, let them sink down. Any tension anywhere, just let it go down to the floor. Any tension that you're harboring in your body, let it go. Now close your eyes and think of a place that you see as safe and comfortable for you. This could be the surf of the ocean, in the deep forest by a stream, a thunderstorm while you're laying on your bed, or a visit with your grandmother. Do you have the place in mind? Think of what you might see in that place. Try to use your imagination. What would you see there? Is there any special smells or tastes? If you're at the sea, you might smell the sea air. If you're in the forest, you might smell some honeysuckle. You might hear a bee buzzing by your ear. Oh, that might make you too nervous. Never mind about the bee. What other things might you experience in that place? Don't be afraid to be creative. Remember to take your deep breaths in and out. All right. Well, let's come back to the room on the count of 3. 3, 2, 1. Okay, open your eyes. How do you feel? Does anyone feel more relaxed? Give me a thumbs up if you feel relaxed, or if you don't have to. Does anybody have any special feelings?
If tired is the same as relaxed, then sure.
Well, you know what it is, especially as you poor students, you're pushing yourself, especially at this time of year. You're trying to get all your assignments done. So you're pushing all that stress down. So you let that go and you actually feel how you really feel. That means you should take an hour nap. Who has time?
Speaking of assignments, I am currently doing AP US history.
Okay, so you're double tasking, huh? Okay, well, let me stop sharing. I want to remind you that I'm a nurse and I'm very concerned about all these diseases of despair that are affecting people. You know, people who are trying to eat away their stress or drug away their stress, or, drinking too much, doing all these other things that are really just making things worse. So I do think there's an answer, and that is just being kind to ourselves and trying some of these techniques out. As a nurse, by the way, I was the director of one of our first hospital-based alternative healthcare centers in the area. We started up in the late 90s through St. Vincent's. Unfortunately, it closed due to budgetary problems, but that was really nice center to have for the community to help them explore alternative therapies for problems. And some of the things that I talked about today may be considered alternative therapies, but I think they're practical solutions. Does anyone have any questions or comments?